handy dandy heat pack is back. So for late stage rehab week 2, we'd start before with the pre-exercise modalities of a heat pack for that tissue extensibility and elasticity, kind of warming everything up, getting it ready to go work out. Leave the arm for about 10-15 minutes. What I would then have him do is go onto his belly for me. We then do some type of dynamic cupping through either infraspinatus teres minor or supraspinatus deltoid, kind of working some of these force couples. We put cups on them and kind of move them around and or have them move with it. So if I put cups on supraspinatus and deltoid, I'd have them do kind of active abduction, shortening those tissues, working through those ranges. Finally, I wouldn't do these every day, but I'd kind of fluctuate between them. I would then also do east into the rotator cuffs to kind of help kick them on. This is just normal east stem, no Russian or anything, but primarily on infraspinatus, supraspinatus. Getting to our exercises, you can step for me. Starting with our strength, stability, and scapular control, we're going to do standing internal external rotation for a progression again. This would be obviously a cable, but for lack of equipment, this is our cable. Go ahead and do internal rotation for me, pulling that band across, and then apply a greater load this week. Great, external rotation. Great. We would do those. We would also do a single arm inverted kettlebell press with a super light kettlebell. We instruct them to hold the kettlebell upside down. You can stand up or sit up, doesn't matter. You're gonna hold the kettlebell here and they're gonna gently push through flexion up as high as they can with a light kettlebell, and then kind of come out and do a 90-degree and then push up too, nice and lightly. This is gonna help work that shoulder strength as well as stability. After this, we're going to do bear crawl, start to load that joint. So what the patient's going to do is they're going to get on all fours and kind of crawl around, and this will help start to load that joint with axial loads. Perfect, you're good. And then finally, for strength and stability, we would do isometric body blades. There it is. And we're going to start to work these in just neutral ranges, and then we get more into sport specifics. You're going to work it here, going external, internal, and then flexion, extension. We're going to do both those two ranges. So keeping that on the side, in and out, good, and then turn it the other way, good. And then the last range we're gonna work early on is in full extension back here, working like this. Good, okay, you're good. Alrighty, for our power section, what we're gonna do is we're gonna go back to our med ball. What we're going to do is we'd ideally be outside on a wall, but what the patient's going to do is they're going to incorporate some lower body as well. They're going to squat down and they'd push up at the wall as high as they could. Since you don't have the space, do a squat, and then as you squat up, push it. Like I said, there you go, yep. We would do that, and then we'd also start to work with some rotational band punches. So what I'm going to have him do is he's going to grab over here with your right hand. You're going to turn, yeah, there you go. You're going to punch up diagonally toward the roof. With the hand, come across your body, punch up. And then they're gonna come back toward me, nice and slowly, and then punch toward the ground. Good and slow, back toward me. Up again, good, and then down. Good, okay, you're good. That's all the power ones we do. Mobility-wise, we'd still work through that sleeper stretch. You can do it if you want to, doesn't matter. So we'll work that sleeper stretch, hopefully getting a little bit more movement and or internal rotation with this one. Okay, you're good. And then finally, we're going to kind of progress the serratus and anterior through wall slides with the foam roller. So if we work our way over here, see, thing that's on it, oops, sliding out, try to keep those elbows in neutral. And then push up. Good. Okay. That way it works, kind of that protraction, upward rotation involved. And then finally, for our TA activations or our core integration, what we're going to do is we're going to do suitcase carries with a heavier kettlebell. This is also going to help with some of that rotator cuff stability. So they're going to work in one hand and kind of just do walks, trying to keep a neutral torso and not lean to one side. So walking there, good. Switch hands. We're going to do both sides. This helps with core and rotator cuff stability because the rotator cuffs also stabilize when we hold large loads. Finally, we're going to do kneeling wood choppers, kind of trying to build that sport specificity. So if you want to go on your knees for me. You're going to grab this with both hands up at the right and come down like you're trying to put your seatbelt on. And go. Good. And you're good. Okay, you're good. Finally, post-exercise, some of the modalities I would incorporate are manual therapies. You can go back onto your stomach for me. We can do either manual with our hands and or instrument assisted. What we would work through is the rhomboids, upper trap, middle trap, lower trap, rotator cuff, infraspinatus, supraspinatus, deltoid, and serratus anterior. These are what we work through with either hands or instrument. You can sit back up. Next, I could also do shockwave to help with these tissues if there's kind of that chronic tightness or inability to move. We can get the shockwave back out and we can work through that posterior capsule. We'll obviously have the shirt off. We can work through kind of some of the muscles up top that help with our primary function and the anterior capsule. These are what I would do for late stage rehab week 2.